Hi everyone, this is a video about heavy metal chelation. Someone posted a question on one of my other videos asking the following question. Will heavy metals come out in urine if the kidneys are in bad shape and not filtering well? Good question. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only, and please talk to your personal healthcare provider before making any health decisions for yourself. Use your best judgment around that, but don't take any medical advice from me over social media. Obviously, we're all sovereign individuals and can make health decisions for ourselves, but please ideally discuss medical decisions with your healthcare provider. Don't take advice from me over social media. So with that out of the way, slightly awkward disclaimer out of the way, great question. So if the kidneys are in bad shape and not filtering well, yeah, that's absolutely going to impact the degree to which anything's going to get filtered out through the kidneys. And in fact, there are specific guidelines around how we can use, actually, let me see here. Okay, I guess I'm reading to this a little bit around like, well, if we're doing chelation therapy, are you actually going to be able to flush the heavy metals out? Just if we have a patient with chronic kidney disease, they have, significantly impaired kidney function. Are they actually going to be able to filter metals out through their urine? Probably not as well as somebody who has nice, healthy kidneys. But the amount of heavy metal that we excrete through our kidneys is relatively small in the first place. First of all, we excrete a lot more heavy metal through our stool than we do through our kidneys. Most people aren't aware of that and don't really think of it. And those of us who have been tested for heavy metals think like, oh, must be urine's the best source because that's the way we test for it oftentimes, or in the blood in some cases. But they've actually done some studies showing that we clear way more metal through the stool. It's just much less pleasant to deal with a stool sample than a urine sample. So that's why the urine testing is done. And it's also just better for provoked urine testing because the frequency with which we urinate is going to be more reflective of what we're hauling out of our cells at a given time from a chelating agent. Stool is a lot more variable in terms of how often the bowels are going to evacuate from person to person. So yes, impaired kidney function is going to negatively impact the degree to which we filter out just about anything, but we don't really clear that much metal in the first place through our kidneys via our urine, our urine via our kidneys rather. In the context of chelation therapy, if we're actively working to get rid of metals, is compromised kidney function going to impact the degree to which we can get rid of metals? And yeah, I would say it probably does as well. Now, it's something where I can't really speak to saying like, well, how does it compare exactly in chelation? I've done in patients who have compromised kidney function compared to those who don't. Well, we always use a lower dosage of the chelating agent because we want to be gentle on the kidneys. So to say, oh, a full dose chelation treatment in someone with perfect kidney function versus, 50% compromised kidney function, how does that compare head to head? I don't know because I'm not going to be the guy that uses a higher, full strength dose of chelation on someone with compromised kidney function. So we really can't really speak to it clinically, but theoretically on paper, yeah, it should likely impact the function or impact the degree to which the metals are being excreted. Now, the other thing to consider with this question is, it says if the kidneys are in bad shape and not filtering well. So if you're referring to actual kidney disease, like where the glomerular filtration rate is elevated or is lowered and not working as well, like there's actual filtration compromise, everything that I just said, it stands in that context. If it's more of I think my kidneys are a bit, hard done by because I've been exposed to a lot of toxins and I seem to have some detox related issues and this and that, but my labs don't actually look abnormal, I don't think that the degree of heavy metal excretion would be really significantly impacted in a case like that. It's kind of like when we say, oh man, like liver function seems to really be, compromised in this person, or like their liver detox pathways seem to be compromised. Well, that's a night and day difference in someone who's actually got, cirrhosis or like other types of liver disease where their, liver function is actually significantly compromised and kind of shutting down. That's like a much more dangerous acute situation in that case. So if it's more of like I'm kind of a bit concerned about my kidney health, probably not going to impact the heavy metal excretion a whole lot. If there's actually documented reduced kidney filtration, then it's going to be a less efficient process. So thank you for the question. Nobody's ever asked me that question before, so thanks for the unique question. It was fun to answer it. If anybody has any questions about this topic or anything else, please post in the comment section below, and I will do my best to answer as soon as I can.